We're back with Dr. Books, a chiropractor, and one of her patients, Marcia Wood. Dr. Books, let me ask you, what is it that you do that doctors don't do? What is what you do so different?
What medical doctors are trained to treat the symptom. You will come to a medical doctor when you have a problem, and the doctor is trained to diagnose the problem and to give a medication or a diagnosis on it.
And then what is it that you do then that's different? They focus in on one thing, and then you...
And they will do that. And often what they will do in the case of dyslexia is prescribe one of two drugs. Ritalin is the one I commonly see, which calms the child down, and it has some side effects. The other one that I have seen, or I've heard about through a book called Smart But Feeling Dumb, which was written by an MD, who often prescribes Dramamine, which is for motion sickness because there is an inner ear disturbance. And sometimes the Dramamine, which is a motion sickness cure, will help again with the symptom, not necessarily with the cause. As chiropractor, we are always trained to try to go to the cause so that the symptom doesn't have to reappear. And so I'm trying to work at the cause level rather than the symptom level.
Marcia, why did you choose a chiropractor? Why not a neurologist?
Well, I had been associated with chiropractors in the past when I lived in another state for neck injuries and other aches and pains and that kind of thing. I also had been treated previously for a seizure disorder and had gone through a neurologist and had gone through other doctors and had found at that time that the one time that I felt like it was like the light bulb that went off and I knew that something different had happened was when somebody did a cranial adjustment. Well, a chiropractor in Ohio had done that. And I felt like for the first time that they were actually changing something in my body rather than giving me a medication to sort of cover up so that the seizures or something else didn't happen again. So I've just followed the chiropractic profession since that time.
Some people too, Dr. Books, will say that this is just a quick fix kind of thing. What do you say to that? Is it possibly true that there's not enough, this is so new, that there's not enough documentation to show whether or not this works?
We have found, this treatment has been around about 6 years now, and we have found that the treatment will hold. It is considered permanent. And it takes about 2 to 3 months for us to really work on this condition. There are only 3 things that would really bring a person out of alignment again. One is if they had a bad accident, a fall or a car accident, which would disorganize the nervous system again. The second reason could be an emotional trauma, the death of a loved one, or some very serious problem. And the third could be a chemical imbalance. If, for instance, a person, it really does have a difficult time with sugar and goes out and eats a lot, then it may slip out. But once a person is very organized with this technique, they will know by their behavior and the way they feel, their inability to concentrate again, they know to come back in and get readjusted.
Is this a final cure, or, I mean, is it once you give your 8 to 15 treatments, is it fine, or can there be lapses?
Good question again. I would never say that this is a cure. Dyslexia is very complicated, and we human beings are very complicated. I know that what I'm doing helps, and it helps in varying degrees depending on the severity of the problem with people. I know that it helps.
We have to take another break, excuse me. We'll give you some warning signs to look for when we return right after this message.
This TV show was filmed 7 years ago. Now I can safely say that the results hold. Recently I interviewed patients that I had worked on 4 years ago, 5 years ago, and even 6, and they gladly tell me that their corrections are holding. We have a success rate of 85% after approximately 3 months of care. There's a point I'd like to make about Ritalin that was just mentioned on the film. Traditionally, it has been one of the godsends to most parents and teachers. And it's a kind of a scary thought that for a teacher who has a room full of children who are disruptive to the class, the idea that the child might not be on Ritalin anymore. I can tell you from a parent's point of view that it's a wonderful thought that a child doesn't have to become dependent on drugs, that he doesn't have to come to believe about himself that there's something inherently wrong with him, something that's not fixable, something that can only be helped by taking something from the outside, and that's drugs.
We're back. Let's go over a list now of some warning signs you may want to look for in your child. Here are a few items that could be a sign that your child may have dyslexia. Difficulty with reading, writing, and math. Difficulty in understanding words in normal conversation. A poor sense of direction. Little concept of time. The inability to concentrate. Poor motor coordination. Bumping into things. Hesitant speech or taking a long time to remember words. And the need to reread the same word or phrase to get any kind of meaning out of it. Dr. Brooks, how does dyslexia affect a child's behavior?
Behavior can be affected in several ways in a dyslexic person. Sometimes a dyslexic child will become very rebellious. They don't fit in the same world. They're a prisoner in their own body. Sometimes it may be just the opposite. A child will get very withdrawn because no matter how much effort they put into something, it doesn't seem to make a difference. They still won't get it, so they give up. They stop trying. I think an interesting statistic on the rebellious side is that 95% of the children in juvenile detention homes are dyslexic, and 80% of people behind prison bars are either illiterate or dyslexic. So it has some very wide social ramifications.
How about their self-esteem or self-confidence? How does dyslexia affect a child's self-esteem?
Well, it can be disastrous. It's really important, I think, for parents, or for adults who have dyslexia to find something that they're good at. Sometimes it's a sport. It may be an artistic or a theatrical endeavor, something that will raise their self-esteem. Because if the child is to compare himself to other people, he feels like he's inferior. And other children will gladly tell him that he's not the same.
We know how some kids can be.
Yes.
Marcia, how did it affect you when you were young?
Actually, I was very coordinated as a child, so I always had sports. And in fact, my undergraduate and graduate degrees are both in fields relating to physical education. And so I chose that avenue because that was my avenue of my greatest strength. I was on the volleyball team and the field hockey team and the swim team. And though I did get good grades, but with great effort, there was a difference between what I thought I knew and what I was able to produce on testing situations. So as long as I had the sports to go into, I was able to keep my self-esteem up. But I am continued to be someone that easily can lose their self-esteem, so that you have to continue looking for something that will help boost your self-esteem.
You mentioned, too, when we were speaking earlier, that you have a sister that's a member of Mensa. I mean, she's very bright. Were there problems coping with that?
There wasn't really a problem of coping with her. I mean, we actually got along very well. It was just the problem of not knowing why there was such a vast difference between her level of comprehension and my level of comprehension. And in fact, I often remember her being up in her room reading books for pleasure. And although I liked to read, it was not something I did a lot for pleasure as a child. And then later on as an adult, I do reading for professional reasons to get information. But we had different means of leisure time because of that. And I just sort of became known as a person who had a lot of common sense. And so my father sort of sent me off to college saying that, some people are very intelligent and you have a lot of common sense, and so that we hope that you make it in college, and if you don't, it's all right. I mean, I was determined to do well in college, and I did, but it was with a lot of extra effort.
You ended up, what did you say, with a 3.8?
3.8, yeah. And most of my grades throughout college were very high.
I want to ask you, too, you have any advice at all?
I think the hardest thing for me right now is I continue to go back to school and take classes. For instance, I just went back and took a class in chemistry and in physics, is that I wanted to be able to take tests in that situation by myself, because I worried so much about the actual test situation that I got so worried about taking the test I couldn't concentrate on studying for the material. And one of the professors in my physics class allowed me to take the test by myself. So all I had to do was worry about the physics formulas and what the content of the course was, and not if the person next to me was going to be chomping their gum, and if I was going to be able to concentrate. So that would be my advice, that if you have a child, if you're a teacher and you have a child who's displaying some of these problems, see if you can set up some environment for them to be able to take tests by themselves.
Very good. I'm going to have to break it up right now. Thank you, both of you, for being with us today.
There's a big difference between curing and healing. Most of our society is based on the concept of curing. That is a quick fix. A Band-Aid here, a quick medication there, Tums for your tummy, acids for this or that. How many of you have tried umpteen quick fixes or cures for your child, and still you have a child that's hurting inside, that doesn't have a world that works for him? Healing, which is what we're about, is an inside job. It requires working on the foundation itself, working on the internal structure, so that a belief in the child is nurtured and fostered, that he believes that he can try something different because his body works. I had a patient who worked with IBM and worked with computers and said about his body, it's hard to program a broken computer. And what Dr. Books did was kind of rewire me so that my computer worked. This work requires listening very deeply and very respectfully, far beyond the words, far deep into the pain level, far into where is that seed of wholeness and how can we nurture it and bring it into its fullness.